Hi, I'm Dhanashri and welcome back to my YouTube channel. Today I'm going to cover how to approach your communication skills station. In the UK, communication skills is given the utmost importance. So if you're preparing for any of the UK based exams such as licensing exams or even your interviews, make sure you prepare the station well. So let's get started. So you must have heard about the spikes protocol for breaking bad news. Let's discuss this one by one. Say, for example, you're given a scenario where Mr. Jones is a 69-year-old gentleman who had an OJD for hematemesis 2 weeks back, and the OJD showed a bleeding gastric ulcer which was biopsied. The biopsy reports have now come back with adenocarcinoma, and you have to break this news to him. Let me tell you how I would approach this. The first step is setting the scene. You need to have a crisp opening statement, confirm patient identity, and then ask if they have anyone with them. This is very important for breaking bad news scenario. I had a set way of doing this. In our previous example, I would say something like, "Hello, Mr. Jones. My name is Dhanashri and I'm one of the gastro registrars in clinic today. Before we proceed, can I get you to quickly confirm your name and date of birth, please?" Once they'd done that, I would say, "Mr. Jones, there's something very important that I need to discuss with you today. So, do you have anyone with you that you'd like to bring along for this consultation?" Or I would ask, "Are you the type of person who needs someone with them when given a lot of medical information?" Next, you need to understand patient's perception. You need to ask what is their understanding of what has been going on and gauge how much the patient wishes to know. So, in our example, I would say, "Mr. Jones, can I just check what has been your understanding of why you had the test and what they saw during the test?" Next, I stands for invitation, where you ask for permission to share the news. K stands for knowledge. This is the most important part of the station, and the examiners are listening keenly to each and every word that you use. So be careful. Important points to note here are, you need to always fire a warning shot first. Do not beat around the bush. If it's cancer, say cancer. Do not use too many technical words and choose your words carefully. So, in our example, I would say, "Mr. Jones, I'm afraid I've got some bad news for you. The samples that we sent have shown evidence of cancer. I'm so sorry to have to tell you this." You pause here and wait for a response from the patient. E stands for empathy, which means showing an appropriate and kind response to any emotion demonstrated by the patient to validate patient's emotions. Here, you also need to respond to difficult questions. This is the most difficult part of the station. In our previous example, I would respond to patient's emotions. So, if my patient is in shock, I would say something like, "Mr. Jones, I can see that this has come as a shock to you." Or, "I know that this is not something you were expecting to hear today." If the patient is sad or just quiet and does not give any response, you could say, "I can understand your emotions, Mr. Jones," or "Your emotions are very valid." At this point, the patient may even ask you a difficult question, such as, "Am I going to die, doctor?" To respond to this, I would say, "Mr. Jones, I can see that you're very worried about this, but we have a very good team here and we will make sure that you are well supported. We're all here to help you through this phase." Again, it is very important to be very calm and empathetic. S stands for strategy and summary. This is the bulk of the station. It's not the clinical knowledge that they're testing, but your communication skills. So don't go into details of the treatment plan. Prior to giving any clinical information, ask if patient is ready for this discussion. Ensure that the patient has a clear plan for the future. It is a good point to introduce specialist nurses and give patients a point of contact. Do not forget to summarize. In our example, I'd say, "Now, Mr. Jones, I'd like to discuss what we're going to do moving forward, if that's all right with you. We need to do some more tests and scans, and they will all be arranged within the next 2 weeks. Then, we'll discuss these reports in our multidisciplinary meeting where all of us sit together and come up with the best treatment option for you. It is good practice to introduce the specialist nurses, so I would say, Mr. Jones, we have an excellent team of specialist nurses, and I will introduce you to one of them today after a consultation who will go through everything again and also provide you with clinical information leaflets to go home with. She will also give you her contact details and be your point of contact should you have any further questions. At this point, I would always check if the patient has any questions. I would say, "Mr. Jones, I know this is a lot of clinical information to take in all at once. Is there something that you'd like me to go over again, or do you have any questions at this point?" Then I would always ask if they would like me to schedule another appointment with a family member so that we can go through this again. Lastly, do not forget to summarize. This is very, very important. In your summary, include all points that you have discussed, right from the diagnosis of cancer to the plan going forwards, as well as the details of the specialist nurses. Lastly, as a closing statement, I would say, don't worry, Mr. Jones, if you don't remember everything that we've discussed today. I will be putting everything in a letter so that it is all documented, and your GP will receive a copy of that letter too. I would end the scenario by asking if they had any more questions and thanking them for coming to see me. Some important tips from my end: have a calm, open posture and neutral position, which means your feet must be flat on the floor with ankles together, your hands should be together, and your palms should be facing downward on the lap. Maintain eye contact with the patient. Match your tone to the voice of the patient. Do not be overly dramatic, but have some voice modulations. Never interrupt the patient when they are talking. And lastly, practice, practice, and practice. So, this is it. I hope this was helpful for you. Do let me know in the comment section if you'd like me to cover anything in particular. Please like, share, and subscribe to my channel if you're finding my videos useful. I'll see you in my next video, and thank you for watching.